Hi everyone, it's your girl again, Bola Tito Fatoki at Sped Everyday. I am so glad to be here this Friday with a very important guest, Dr. Omobola Adetunmbi. I'm sure you enjoyed this episode of Sped Everyday. It's going to be about emotional disturbance. And Dr. Adetunmbi is an expert in the area. I would like to read her profile so you can really understand why she's here with us today. Dr. Adetunmbi Omobola is a child and adolescent mental health consultant and an ardent lover of children. With over 10-year experience as a medical practitioner, most of which has been dedicated to helping patients and their families through mental illness, she has been exceptional in providing counseling and medical help to those who need it most. She currently works in the capacity of a child and adolescent mental health specialist at the Federal Neuropsychiatric Hospital, Yaba, Lagos, Nigeria, where she offers counseling and medical evaluation to diagnose and treat children with a variety of mental health conditions and substance use addiction. She also partners with local hospitals and non-governmental organizations as a visiting consultant to provide mental health care. She is the founder of Psyche Wellness NG, an online platform which you can also follow that provides support for families of children with special needs and also give parenting tips to caregivers to ensure adequate development of children into mentally healthy individuals. Areas of interest include child and adolescent mental health, including but not limited to adolescent, addiction, management of neurodevelopmental disorders, emotional disorders, which we're going to be talking about today, child psychology, among others. She had a medical education in Ladoke, Akintola University, Ogbomoso, also in Nigeria. She completed her residency training at the Federal Neuropsychiatric Hospital, Yaba, Lagos. We're going to talk more about that today as well. And backed a fellowship from the West African College of Physicians, Psychiatry in Psychiatry. She also has a master's degree from the Department of Psychology, University of Lagos. You know, I had to read all this out because we really need to know who we have today so that my parents and other people that have been talking about Nigeria, they need services, they're trying to find where to go with a child with special needs can understand and know that we have resources that can help these individuals. So welcome today, Dr. Adetunmbi. How are you doing?
I'm doing fine, thank you. Good evening.
Good evening. Thanks so much for coming on today. We really appreciate that as Sped Everyday, and I personally appreciate that as well. And I'm sure everybody's waiting to hear from you.
It's a pleasure. I'm so glad to be here.
Thank you. So we'll just go straight in. That's a big profile. But before we actually go into, talking about emotional disturbance, I just need you to say something about Yaba, like where you work, what are the resources available so that parents can, gain one or two things. I've had issues on questions about where do I go in Nigeria? Is there, and I know Lagos is more of a centralized place that people can always go to. So is there something you want to, talk to us about where you work and what they actually do over there?
Well, thank you so much. I'm so glad to be here. Well, I work in the Federal Neuropsychiatric Hospital, Yaba, where I also had my residency training done. Yaba is not a new place. It's an over 100 years institution, but it seems people know Yaba for not all the things that Yaba can offer. Mm-hmm. So the hospital has a very structured child and adolescent mental health center that cares for children and adolescents with mental health needs of various forms. So the hospital is located in the Oshodi area of Lagos, and it has all the complements of the resources, care, and everything that you need for children and adolescents going through, any difficult area in their development. So that's where I work, and the place is open 24/7, every day of the week to clients and their families.
Thank you. So you mean you don't just see individuals with emotional disturbance. If I have an autistic child, If I have a
Yes,
child
of
Down
course.
syndrome and all that, I can come over there.
Yes, definitely. The center is, as I said, is a specialized center for anything child and adolescent mental health or neurodevelopmental disorder, autistic children. We provide care, children with attention deficit disorder, children with other emotional problems, and so on and so forth. So the center is there to provide care.
Thank you so much. We'll still talk about that later, so I can know like what kind of physicians we have there, what kind of resources, what kind of doctors like we have there. So we'll talk about that later. So let's just go in. So the question today is that what actually is emotional disturbance and what conditions do we have under it? So when I hear the word emotional disturbance, what should I be thinking? What does that mean?
Well, when you hear emotional disorders, what should come to mind are disorders that affect the way an individual feels, the feelings of an individual, and subsequently that would affect the way an individual behaves. So individuals, children with emotional disorders have problems, identifying or thoroughly processing feelings.
Mm.
And this affects their behavior, their thoughts, even interpersonal relationship and all of that. So when you hear emotional disorders, know that they are talking about problems associated with feelings and behaviors.
Thank you. So would you say that conditions like what kind of conditions? Because I know we have different conditions, maybe like depression. Some people may, have disturbance in their emotions if they are depressed. Are there other conditions attached to this?
Yes, depression is just one
Okay.
of emotional problems. For emotional problems, we could have the externalizing disorders.
Oh, I think we just lost her a little bit. If you can hear me, Dr. Mobola, the last thing we heard from you is external.
Probably the child has aggressive tendencies, temper tantrums, conduct disorders, or oppositional deviant disorders. So those are examples of emotional disorder that are externalizing. While internalizing disorders would include things like depression that you mentioned,
Mm-hmm.
anxiety disorders, like OCD, obsessive compulsive disorder, you
Wow.
know, bipolar disorders. These disorders are more internalizing because the person puts these emotions inside. The person is personally dealing with this. And if the person does not narrate the experience to somebody else, you might not really know what the child is going through. So
Mm,
that is why they are called internalizing disorders.
others. Oh, wow. So it's not all disabilities that we can see to our face.
No, you can't see everything unless the person volunteers information or shares the experience that he or she is having before you can really understand what the child is going through.
Or also maybe if, as parents, if we observe some things, right? So what are the things that we can observe in people like that to be able to give them the necessary care or attention or help that they need?
So as parents, there are things to look out for in children for
Okay.
us to know if the child is probably going through an emotional disorder. For
Mm-hmm.
example, if you notice that your child that was very, lively, bubbly, full of energy, is
Mm-hmm.
suddenly withdrawn, find it difficult expressing himself or herself.
Mm-hmm.
Things that he or she loves to do before, like hobbies, activities in the home, the child does not seem to like them anymore. She's just sulking and withdrawn and alone most times. Then those are signs that this child might be going through some things.
Mm-hmm.
Also, if you notice that your child is finding it more difficult paying attention, the child is not concentrating at task. You give the child a chore and the child is not able to follow it through to the end. Those are signs that some things might be wrong. Yes. Also, if your child is not sleeping well as he or she used to, or not eating well as he or she used to, then those are signs that something might be wrong. The child would need further evaluation to pinpoint what type of disorder the child has and also to offer treatment.
Oh, thank you so much. So, parents, this is just to let us know that we need to observe, we need to pay attention to our kids. We need to actually know our kids, because if we don't know, we're not going to know when something is actually wrong. And like I always
Exactly.
say, we should not just take things for granted, no matter how little it is. I always believe that it's always better to at least make sure you check. So if at the end of the day it is not what you're thinking, I think it's still best knowing early and intervening early than pushing it forward and just being negligent about it, and then it escalates into a more um into escalates into something worse than we can imagine. So again, parents, like doctor has said, let us be observant. Let us pay attention to what our children are doing and what has changed. Also, like, I want to find out this emotional disturbance, is this something that only occurs in children, or we can also diagnose adults, or can a child, like, as a child you can have it and outgrow it, or as an adult you can pick it up? How does that work between children and adult?
Okay. Um, Emotional disorders are seen in children. They are
Okay.
seen all across the lifespan, from childhood up to adolescence, to early adulthood, and even to the very old people. Some children actually have these disorders, and then if it is not properly managed, they grow up with it. They grow up into adulthood
Mm-hmm.
with these disorders. And studies have also shown that adults that have emotional disorders, their children, they have twice the risk of having it.
Wow.
Meaning, an adult that has an emotional disorder should look out for the children. Children are more likely to also develop this or even some other form of emotional disorders. So it can occur across the lifespan from childhood up to late adulthood. So, but the course depends on how soon you're able to pick this disorder in the child,
Mm-hmm.
how soon this child is able to access treatment,
Mm.
and the kind of support this child has even while growing up. We've seen children that has an emotional disorder as they were growing up, probably in their preteens or teenage years. But as they grow up with treatment, support, and everything, they develop to become well-balanced adults.
Mm-hmm.
Well, if these treatments are not adequate, or there are other factors, environmental factors, affecting the child may grow up with persistent symptoms, and this affect the person's functionality, relationships, and all of that.
Oh, wow. That's huge. So let me ask, because I know there are also environmental factors, right, that would let a child or somebody pick up that kind of disability. Is that
Yes,
true?
yes. Yeah, yes, you are very right. But the factors that are associated with development of emotional disorders in children are not just environmental. We have biological factors. These are factors that has to do with you inheriting, a child inheriting this disorder from the parents
Parent.
because of the shared genes and shared hereditary components. So this make a child vulnerable as it is to having an emotional disorder because the parents or because somebody in his lineage, it might not be the parents, it might be the grandparents or some other person in the ancestral lineage had it.
Mm.
Because we see parents say, I don't have this. How come my child
As it.
has it? Yes. And it's because sometimes these disorders also skip generation. It's
Mm.
not sacrosanct that once a parent has it, the child also must have it. It might skip a generation or two and then manifest in a later generation.
Mm.
If all the factors that would make its expression, if they are available and favorable,
Okay.
then the child will manifest with it.
Oh.
So now, the environmental factors that can make somebody that has a genetic tendency to have these disorders now manifest include things like parenting styles.
Okay.
The kind of parenting a child has a long way to determine if this child will have this disorder, despite having the genetic
I think.
predisposition.
Mm-hmm.
So a child that grows up in an environment of so much hostility,
Mm.
an environment of so much conflict, when there's no love and affection, is likely that the child will come down with an emotional disorder like depression. While even if a person has a genetic tendency, but grows in a loving environment, in a supportive family, where the needs, the emotional needs of that child are met, the
Mm,
child may not have the disorder, even despite the genetic
exactly.
predisposition. So parenting plays a very huge role. Other environmental factors like schooling, how the school is structured, if the child is exposed to bullying in the school, other environmental vices, even things like exposure to conflicts in the environment, all of this can affect the chances that a child will have an emotional disorder.
Thank you so much. That's I love that. And I just want to add that parents need to watch what they do. Like as parents, once you know you have a child or you are a parent figure to any child, you just need to be careful about your environment, what you do, how you talk to these children, and you try and listen as much as possible. I know as parents, sometimes you can be very stressed. You've gone to work and your child is coming up with something, but you're like, go sit down. I'm going to talk about that later. Children are different. The way they process this information is different. What they've heard in school about how their other friends, what they do with their parents at home, the kids think about all that, they process it. And we can never know how deep our children would process things like that. Then when we have cousins, families around as well, let's be sure that they're not bullying each other, not just in school, because kids get home, they have cousins living with them, they have families living with them, they get bullied as well. So all these processes, and then I know that we have psychologists, psychiatrists at home, because I've seen kids that actually went into so much depression, because they've had deaths in the family, they've lost one parent, but people think, oh, they're just children and they will just cope with it. I think it's time for parents to also ensure that they have counseling resources for children. When there's death in the family, where there is an issue, there's a divorce or there's separation, we should try and, as much as possible, look at these kids and not just feel like they're children. They are children, but they have their brain. They can process things. I think it is advisable that we do take on resources that can help them, through that processing. Like I talk to my children. I'm sure you talk to your children every day, but there are times an expert needs to talk to them. And these experts, they are so people. A lot of people, like in Nigeria and other countries, they may think like, oh, I don't want my business out there. But these people are trained to be confidential about your business, to be confidential about the information you give, and it is their job. So parents, I want to say, please let us use such resources. They can help avert these problems, because at the end of the day, what you will be trying to do to stop it from escalating will be more than what you should have done if there was an early intervention. Is that true, Dr. Adetunmbi?
Yes, you are so right. And as a rider to what you just said, a lot of people, especially in this part of the world, they believe children are children and that they will forget.
Mm-hmm.
They believe they can expose children to anything or say anything to children, that they are children, they would not remember. But everything, the child's mind is like an empty plate.
Mm.
It is what you put there that develops into who that child is going to be. So
Doc,
parents, we need to
we
take an
just
active role
lost,
in our parenting.
Doctor, we just
We
lost.
can't live.
Can you hear me?
Oh, so sorry.
Yeah,
Yes, I can hear you.
the last thing we heard is that the child's mind is an empty plate. Then the internet
Yes.
glitched. Yeah.
Oh, so sorry. So the child's mind is like an empty plate. It's like an empty slate. What you write on that slate determines what that child is going to be. So that means as parents, we have an active role to determine how these children are going to end up like. What you put in is what you get. So we need to understand this in our parenting. Parenting is an active involvement in that child's life. We cannot afford to leave things to chances. So in our parenting, we need to impute the right things, the right values into the children. And this goes a long way in helping them form the personality and the character that they're going to grow up to adults to be. And also help in preventing things like emotional disorders that we are talking about. Yeah. Talk to your children more often, know what's going on. for example, change children's schools without talking to these children about it, without feeling that these children will miss their friends. They move to new neighborhoods without, carrying the children along with it. The child just wakes up one day and finds himself or herself in a new neighborhood. And there was no involvement, and nobody seems to understand that this child too has feelings and emotions, and these activities would go a long way in affecting how these children will end up to be. So as parents, we should be very careful. Every activity has a role or has an impact in our children's life.
Thank you so much. Thank you. So I'm going to ask, because this will definitely roll into the part B of the conversation. But before we go today, I also want to ask so that parents can know what to expect, because I'm telling you, this is information that you want to really come back next week and continue watching from where we're going to stop today. But before Dr. Adetunmbi leaves today, I want to ask, can treatment be provided? Can this, like, does this have treatment, and who does the treatment?
Yes, these conditions have treatment. Okay. And not just treatment that work. These treatments are based on proven scientific practices and principles. So there are treatments available, and this treatment work. I'm emphasizing that the treatment work because in our own subculture, a lot of people believe, oh, any child or anybody that has any mental or behavioral disturbance, that is how the person is going to be for the rest of his or her life. This is not so. Treatment, the outcome of treatment depends on things like early intervention. The earlier you identify that there are things in this child that are not peculiar to that child, or this is not how that child used to be, and you talk to trained professionals on it, and child gets treatment, the earlier the better. And there are treatment options available. There are professionals also available to treat these children. Most times when we see children, we get them referred from the pediatrician. But the child psychologist or child psychiatrist are the professionals that are meant to take care of emotional problems in children. Awesome. So if you go to see your pediatrician is going to refer you to see a child psychiatrist.
Good. Thank you. So we're going to stop here today. And one thing I want you parents to know is that coming up next week, we're going to be discussing some of the treatment, and also in the eye of an educator, I'm going to be also giving tips on how we help in the classroom to let these individuals learn as well, because of course this treatment goes from the experts at the hospital or clinic to the home, to the school, and to other environments the child goes to, like the church and everywhere in the community. We're going to talk about how individuals in the community can help them as well. We're going to talk about what can happen if these people are not taken care of early. And we're going to still further talk about early intervention that we always talk about. So again today, Dr. Adetunmbi, I want to say thank you so much for being part of this. Thanks for your support to Spedeveryday. And viewers everywhere, I want you to understand that if you need to follow Spedeveryday on YouTube, you need to subscribe so that you can get the first-hand information. And also make sure you go on Instagram and click on follow on psych.wellnessng. And with that, you'll be able to communicate with Dr. Adetunmbi as well. She's an expert in this. Mine is about education. I'm more of an educator. I'm an educator. She is a doctor. She's trained in this area. And that particular niche for your child, especially when it comes to mental health, disabilities and all that. She has a platform where she talks about all that and as well assist people. So until next week, remember to click subscribe, share, and the notification bell so you can get the information just like that. Thank you so much, Dr. Adetunmbi. Do you have anything to say to our subscribers and viewers?
Well, thank you so much for having me. I want to tell everybody to look out for the second part. The second part is going to be more juicier than this anyway. So I want us to look out of the second part, and I'll also look forward to seeing you all.
Thank you so much. Have a great day.